From WRAL News and the Capital Broadcasting Podcast Network, this is your Coronavirus North Carolina News Brief for Friday, January 1st. I'm Lena Tillett. In their final briefing of 2020, Governor Roy Cooper and State Health Secretary Dr. Mandy Cohen announced an update to the state's vaccination plan meant to align with new federal recommendations. North Carolina is currently in Phase 1A, which includes healthcare workers fighting COVID-19 and long-term care staff and residents. The next phase of vaccinations, Phase 1B, will open in groups, starting with Group 1, which includes anyone over the age of 75, regardless of medical condition or living situation. People in this group do not have to have a chronic health condition. Group 2 includes healthcare and frontline essential workers who are 50 or older. Group 3 includes frontline workers of any age and healthcare workers of any age, regardless of whether they work directly with COVID patients. The state expects this to begin in early January. Anyone over the age of 75 hoping to get vaccinated should be able to contact their healthcare providers, who should be prepared to distribute vaccines as early as January 11th. The specifics of the phased vaccine distribution plans in North Carolina can be found on the state's new vaccine website, yourspot.yourshot.nc.gov. Regarding North Carolina's case count, the spread is so critical, the White House issued new warnings to the state this week.
If you are under the age of 40 and you gathered beyond your immediate household, you need to assume you became infected with COVID even if you don't have any symptoms. The task force warns that if you are dangerous to others and must isolate away from anyone at increased risk for severe disease, and get yourself tested. As the governor mentioned, the White House task force report also says that if you are over 65 or you have significant health conditions, you should not enter any indoor public spaces where anyone is unmasked, and you should have your groceries and medications delivered.
Another big headline headed into the new year is a new variant of COVID-19. The first confirmed case is a male member of the Colorado National Guard. I spoke with UNC Infectious Disease specialist Dr. Lena Gralinski about the new variant.
So we want to begin with the bigger picture. What is a variant and how did this happen?
So a variant is the same virus that we've been talking about all year long, except it has one or more mutations that have really held fixed. Viruses mutate almost every time they replicate, but not all of these mutations stick with the virus over time. So a variant is a sequence that we see popping up over and over again, and initially it'll predominate in a certain area, and then as we're seeing now, spread around the rest of the world if it takes over.
Is this an example of the virus adapting to our proactive measures?
Not yet. That's really a question on everybody's mind and something that we're going to be looking out for in the future. But this variant seems to have come up all on its own. Honestly, there really isn't any selective pressure on the virus yet. Not enough people have been vaccinated. And the sequence was first detected in the UK back in September, very low numbers then. And then in November and December, they started seeing more and more people were testing with this specific variant of the virus. So that was before vaccines were even a thing.
What concerns you most about the fact that it spreads quicker than COVID-19?
So the fact that this variant seems to transmit more readily, spread to more people more quickly is really worrisome to me, because our hospitals and our doctors are already incredibly overwhelmed. And so a new variant doesn't need to be particularly more deadly to cause a huge amount of distress to our society. Just the fact that, if you say, previously, maybe 10 people were infected and they would each on average spread to one more person. So 10 people leads to 10 people leads to 10 people. Now we have maybe a situation where 10 people leads to 15 people, and then it just kind of goes exponentially from there. And so with each round of transmission, you get to more and more people, and there isn't room for this in our hospitals.
All right, I feel like I understand this much better after this interview. Thank you so much for your time tonight, Dr.
Thank
Gralinski.
you.
For the North Carolina Coronavirus Podcast News Brief, I'm Lena Tillett.